Doctor, could you explain the significance of the Electrical Interstitial Scan System, or EIS, for diagnosis?
Sure. The EIS is a enormous improvement on medical testing devices because it's so comprehensive and give us the chance to interact with the client by visualizing what's happening in the body. The biggest achievement is the showing how the body functions on the computer screen. Like you can see your heart, you can see your lung, you can see your bladder, how it functions and what's happening in there, and it's quite fascinating to anyone, from kids to old, to see how my body functions. It never happened before, and that creates an environment which brings the practitioner closer to the client and absolutely gives a chance to explain, and with the very limited knowledge people would understand. In the past I had most problem with that. I didn't know how much the person don't know, because I expected some area at least, the person catching up what I'm talking about. But now I just need to point my finger and that is it, that's yours, that's how that works, and that's why you're having a problem, that's why you have the cough, or that's why you pee too often, and people can understand. As a medical device, came out after 7 years research in 4 hospitals and 2 universities. Originally, the idea came up by a team of researchers, who's one is German, the other one French, the third is Russian, and they created this device from previous equipments, upgrading previous equipments. Like I have a grandpa model which does part of it and do it quite well. But that little baby is just absolutely unbelievable. Like I'm spending days and nights at the moment trying to get how far gives information from someone's body. Other day I spent 5 hours just satisfy one of my questions about a subnormality of my client. But on the other hand, this takes only 4 or 5 minutes to complete, and that's the easy part. The hard part is the explanation, and what I'm doing, I explain as much as possible in an hour or 2, and then send the report to the patient and the treating doctors or naturopaths, because that's the other enormous benefit of this equipment. It brings together the two diverse modality of medicine, the mainstream and the complementary side, and finally we have something which is called integrative medical device, showing the same thing for a naturopath as to a doctor. By having the equipment also gives the possibility to link information together, because if I, for example, have my clients comes all over the country and the world, I had huge difficulties to communicate with the local practitioners or doctors. With this equipment, I just send the email and show, hey, that's the problem with the heart, please check it out. That is a monitoring device. The best part of it is to keep tracking improvement or disprovement of the treatment procedure. I can check monthly, weekly, or even daily the effect of supplements and the treatment procedures, which is an enormous saving on time and resources, because I don't need to send the person to scans and blood test and urine test and this test and that test, which takes weeks and days to complete, and it's costly. I just pop the person on the computer and we see it. That is the huge difference. It's not like I'm going to the blood test and waiting when the result comes back. It's straight away seen.
Yeah.
And it's front of the client and say, yeah, I'm improved 10-20% or I didn't. It's very simple, black and white. And then for the practitioner is, okay, it's improving, keep going. Not improving, change strategy.
So its implications are enormous.
Absolutely, absolutely.
Yeah.
And it's just the beginning, because as a new baby you always have a little thing to do with it, and the improvement with it's 1800 devices around the world. It's only a few in Australia, like I'm the third who received one, and hopefully with professional help that will the word spread, and that practitioners on both sides of the fence will get into it, because that's links. Like finally we have something which as a naturopath understand what the doctor done, and as a doctor, and that is the main thing, because naturopaths trained to understand doctor, but no doctor trained to understand naturopaths. So far, hopefully we're in the process to do so. With this equipment, the communication is the same language. Like if I send a information sheet to a doctor these days, he thinks I speak Chinese. And many times, especially for the client and for those who's not trained medical terms, a doctor's prescription or referral is Sinhalese. It's very hard to understand, because we as doctors train to talk on a language what the client don't understand. They're not putting too much fear in the person if it's have a cancer or have a tumor or having something. It's a kind of covering up till the real things happens. But with this device, it's the communication is in the same language.